Good morning and welcome to Frontiers of Knowledge segment of Dr. Lamba's Awakening Call. Last week I talked of astrophysics and engineering technologies being sent into space by Israel in its novel attempt to establish a sort of a laboratory over there, as well as to protect the future space travel. But then, can you ever imagine human life without medical help, without Medicare, without medical technology being used in one form or the other? So Israel is again undertaking an absolutely innovative step and is sending, rather shall I call it, transporting medical technologies into space. And this is not going to happen in distant future, it's going to happen in 2022. The first thing they're sending is they're going to set up a lab over there to analyze bacteria production in space. Now, bacterial pathogens are the leading cause of foodborne illnesses here on this earth, but they can be much more in space. So, this technology would test the growth of E. coli, Salmonella, bacteria, and state of art RNA sequencing techniques in space, and it will also study how the bacterial diseases in the space are likely to be spreading, and is there a possibility of their being brought back to the earth? Is quite a substantially large sector, and the Center for Infectious Diseases at Sheba Tel Hasnoma is involved in this, and this is going to be a path-breaking attempt by Israel. The second is they are sending BBB. Now, BBB is a blood barrier, is a biological marker leading to Alzheimer's disease. So, they want an experiment to be conducted of microgravity on vascular functions of the brain and how a cure for Alzheimer's can be found. Now, you might think, why conduct this study in space? The purpose is that Alzheimer's disease advances slower in space. So the researcher will attempt to mimic and study how that disease progression may be reduced using this method. If the atmosphere in space can be created in the hospitals here where the patient can be put in, and whether BBB on a chip can find an ultimate cure for Alzheimer's disease, then there's an experiment. They want to have a urine analysis in space because in space it is to analyze the results of real-time astronauts aboard the station. And then, as we know, next week Jeff Bezos is going to fly into space. And then Musk has already said that he's going to send people in space and people are booking their seats. So this test would be conducted to examine various health conditions, including kidney functions, perform ACR, that's albumin to creatine ratio, to detect elevated protein because you're not getting normal food over there. It's pills and medication. And allied to this would be the study of microbe in space. This will be used to have genetic sequencing. Now, absolutely out of this world, and it would be done to ensure that the people, when they go into space, remain healthy. But what's still more important is when they come back to this planet, They do not bring with them such diseases that can be a disaster, a worse disaster than this corona pandemic has been. Now, one of the biggest problems that the people over there are facing, and has been revealed by all the astronauts when they come back, is that stress level is very high. And since you are in a zero gravity area, your mental resilience suffers. So they are going to monitor stress levels to enable improvement in mental resilience. It will study, examine astronauts' emotional status using sensors throughout the mission. And they will not only study the vital signs, but also the sleep physiology, cognitive functions, visual and auditory performance, and emotional skills. They'll also examine the impact of stressful events and the management intervention. Now, again, the relevance to the modern world is there because if you can monitor stress in extreme conditions of isolation, of being away and living in a virtual world, then the same techniques, care, can be adapted to the real world. So, virtual world experiment would be, in fact, used in the real world. And there's something which is very strange is that they're going to use a new concept of cognitive testing for astronauts and they will use a telephone. This medical device developed by Israel has already been approved by FDA and it offers medical neurological surveys by monitoring motor and cognitive controls. As a matter of fact, the space ages brain much faster and the possibility of the people who go into space, whether as astronauts or whether as tourists, of suffering from Parkinson's, Alzheimer's, dementia are pretty high. So this medical device, encephalog, would test them on a continuous basis and will allow the astronauts to test the technology feasibility in space for long-term measures, especially for the people who want to go to space and colonize it over there. Another problem they are facing is cardiac issues. So cardiac ultrasound will be performed on heart tests in real time using ultrasound devices. And this is could have been done earlier, but I'm amazed that neither the Russians nor the Americans or any other nation, including Canada, has been sending to ISS, International Space Station. Nobody thought why the cardiac ultrasound work could not be conducted in there. So Israel is doing it, where the astronauts will perform high quality ultrasound scans with the help and training. Now, here it is. It will not be with the help of a qualified doctor, but with artificial intelligence. They are going to use a widget in real time, expert analysis, interpretation. The purpose is to gain insight into testing cardiac health in space and then expand such advances in remote locations around the world and in space. So, if you can do something, say, in space, you can maybe use the same thing in Togo and Tasmania or in Tibet, far out, far flung places. And then another thing that you're going to do is they're going to use miniature infusion devices using IV infusion pumps via remote control. It will allow independent intravenous infusion powered by a battery and USB to connect a secure medical visit, which will evaluate the operation of the medicine. And you might say, why? A, it's obviating the paramedic need of the nursing staff who have to give the infusion. Here, the astronaut or the traveler would be able to infuse the medicine, the antibiotic, or even food by himself, and it will be controlled, as I said, by artificial intelligence. People who have been in space have often complained that when they come back, they suffer from issues of eye, the basic, all the neurological functions, heart rate, microvascular diseases. They are placed in front of the eye to process the images with algorithms. And the computerized learning methods for detecting morphological changes in the eyes are important because the eyes perceive things, and when the strange things happen, when the even the light is different, the perceptions change, traveling millions of miles out. So they are going to send a machine for ocular imaging to diagnose the eye issues in space. Let's not deny the fact that the space is quite harmful to the human being, and the risk is abundant over there, including the dismal phenomena of space blindness. Some of the astronauts, when they came back, complained of blindness for a couple of months, and they had to undergo specialized. So, can it be done over there? So, the transition from the Earth to space and space to Earth doesn't leave them visually impaired. Another major problem is red blood cells, RBCs, the production and the maintenance falls because of the change in the food, change in the habit, sleep pattern, everything, and the zero gravity. So, Israeli's preclinical development stage bio company for the space has developed a process to produce universal red blood cells. Now, these are universal and they can be used for transfusion. You don't have to use whether it's a blood group A or B or A negative or B negative and positive. No grouping. It's a universal red blood cell. It's suitable for the patients of all groups, and it will examine the use of the universal blood cells in the space mission. And if it can be successful there, world is facing the shortage of the blood transfusion. Blood is always in a short supply. So that can be then synthetically produced the way yesterday Israel has produced real milk, but not from cows. The chemical composition, the nutrition value is the same as that of milk, and the taste the same. Well, that's a different subject, but I was just comparing it. The same way the milk they have produced in the lab, they want to produce blood cells and use them. Then medical reports from the various space flights have studied that astronauts' visual functions, visual acuity, retinal functions suffer. So what happens is by the time they come back, the issues are ingrained and many times it may not be possible to repair the defects. So what they are going to do is test it over there and by artificial intelligence and by long-term Medicare, treat the eyes over there only. Basically, they'll focus on space effect on astronauts' vision and physiology of the eye. Now, when I say astronauts, I don't mean only the astronaut, but as I said earlier, even the space travelers, which is going to be a common thing. And then Israel has developed a clock which will monitor vital signs in space. No, NASA, you might be thinking that this is already being done. No, NASA is monitoring the vital signs at all times. But currently, there's no version of comprehensive mobile monitoring. This clock, which Israel has developed and is sending, includes 15 essential monitoring cues on a single clock, and the total diameter is 4 inches. So this clock, or this timepiece, or the watch, whatever you want to call it, will 24 by 7 monitor the functions, and 15 functions will be monitored simultaneously. Then, as I said, dizziness, diseases caused by the microgravity can affect human beings. So they are sending an eye tracker to monitor eye activity, and then the repetitive, uncontrolled movements resulting in reduced vision would be coordinated by artificial intelligence, and situation would be set right. And most important, I call it is antiviral T cells, the immune system, which is even now suffering in the days of pandemic. This is likely to collapse because the whole atmosphere is different. The weakening of the human immune system and the stimulus signals against pathogens are reduced almost to nil. So what they are sending is this antiviral T cells. They'll continuously fight virus and activate immune system. Again, the underlying presumption is that the same with some alteration can be used on the earth as well. And then the diseases over there might be different. Infections are different. So they are sending a CRISPR. It's a genetic editing method which will enable sensitive genetic detection without bulky laboratory equipment. So this CRISPR is being sent again for genetic editing. Who knows? There might be aliens living there. There might be intermarriages. Would the genetics be suffering? Would the children of those interstellar parents have a different genetic buildup? If so, how to ensure their good health? And also to identify pathogens that may cause astronauts to fall sick. And then, most important, I would call not most important, each is equally important. They are sending human astrocytes, prolonging life in space. This is a new experiment they have developed. Brain cells surround neurons and play a vital role in brain and metabolism as humans age. And all these diseases of brain, whether it's Alzheimer or dementia or Parkinson, are because of the decay of the neurons. So, how to prevent it? But the situation becomes more alarming because they say that 1 month in space is equivalent to 10 years on the Earth. That's much as aging process. So the purpose is to study these cells and examine the method of prolonging A, longevity of life, B, the health of the brain. So these human astrocytes would be sent along with a space mission in 2022. And then, of course, they are going to see that the bone and the muscle function, which suffer, as I said earlier, in the microgravity and zero gravity area, the bone functions would suffer, the muscle functions would suffer. And astronauts have suffered from bone and muscle degeneration in long term measures. So Israeli startup companies have now said they are going to ensure increase the bone mass and improve muscle function. So the person would not suffer from the environmental issues over there, but they'll be able to maintain their health the way they are. And then chemotherapy. The rays over there, we don't know how much ultraviolet would be there, how much infrared would be there, different sort of radiation would be there. So they are going to send chemotherapy process along with the same station to study chemotherapy in space. So these new advances, which could happen on this earth, are being, as a matter of fact, pushed at a warp speed. And it's being ensured that the space station, when it goes over there, not only does it create ideal situations for the astronaut who might live there for 6 months or 8 months. Normal stay is 6 months in the ISS, but also for the travelers and the future immigrants to the space. So these medical technologies, well, there's just a comment by Mr. Singh Jaspal. At this rate, they could try for birth of human being in space. Quite possible, since they're already thinking of the interstellar children. So the birth of the human being is not something beyond imagination. And that's why these medical technologies, if they are developed as per the needs of the space, as per the environmental, climatic, and gravity needs, which are much different than the planet Earth, yes, human beings could breed over there in a normal way and maintain a good health. So this is going to be a path breaking space travel, and it's going to ensure that the possibility of interstellar travel, interplanetary travel can be safe for the human beings here and there. Thank you.